Could it be as bad as last time or even worse? COVID-19 has been with us for more than 6 months. Everyone knows what it can do, but understanding COVID defeats some of the best brains in the world. In Europe, winter is ahead, and with it the flu virus as well. Increased testing on COVID has exposed an increase in positive cases, yet death rates had fallen in some countries, only to start rising again recently. Experts say there's been some complacency.
First of all, you see it in the community, particularly in younger people, and then 3-4 weeks later, it starts to creep through into those who are older and those who are potentially more vulnerable, and that's when one starts to see the hospital admissions rising. That's when one starts to see the number of deaths rising. So I don't think we should be deceived that just now, in some places, one's seeing more detection, more cases, but not more deaths.
What the professor says there is borne out by the statistics. Here we're looking at Spain, France and the UK on April the 1st at the height of the pandemic. It's a 7-day rolling average, and these are infection rates. Spain in the 7,000s, France in the 4,000s, the UK in the 3,000s. Fast forward to September the 23rd, and rolling averages are up. Spain with more than 11,000, France 10,000, and the UK 4,000. What's happening to the death rate at this stage? Back in April, it was measured in the hundreds. Getting more up to date, you'll see that dip in deaths. But on September the 23rd, they're rising again. 113, 59 and 25 respectively. That backs up what the experts have been warning about. Don't be fooled when infections increase and death rates go down. While Europe grapples with the COVID crisis again, in other countries there's been no respite whatsoever. More than 21,000 infections in the United States on April the 1st, Brazil 629, and we've picked out India with some of the most densely populated cities in the world, but only 188 infections. Move on to September the 23rd again, and the US shows nearly double the infection rate, 42,000. Brazil not far behind. And look at India, the highest of all, approaching 90,000. For deaths on April the 1st, the US was at 609, Brazil 26, and India with only 6. In September, it's far worse. Deaths hovering around 700 in the US and Brazil, and beyond 1,000 in India.
There's another worrying factor: underreporting in countries suffering conflict past or present, such as Syria. Official figures there show 160 deaths in Damascus. Medical researchers say that's wildly inaccurate.
Based on our report, we would suggest they're far more further forward in their epidemic, potentially with almost 40% of the population potentially infected, and anywhere above sort of 4,400 deaths that have probably been missed.
There is no cure for COVID yet. For now, no one can afford to ignore the science of statistics. Andrew Simmons, Al Jazeera.